All right, guys, we have another car video. I wanted to do sort of an exosomes update, I guess. I guess it's not really an exosomes update because, as we already know, the treatment did not go well. But I kind of wanted to talk about a few things. I guess it might be helpful to talk about these things because it will highlight maybe how long exosomes. I don't want to say how long exosomes last in your system because technically they don't stay in your system very long. They come in, they send messages, and then those messages and that activity is what lasts a while in your body. So this might be kind of a good way to gauge how long the effects are going to last of exosomes, whether good or bad. In my case, negative effects. So one of the things that I did report that was a positive, or I guess an improvement, was my lack of infections. So I'm trying to think back. So at this point, right now, it's about mid-May 2023. I did the exosomes at the end of January 2022. So it's been, I think it's like 14. We're at 14 and a half months post exosomes. So I did report, though, soon after the exosomes that I was not experiencing my recurrent infections. I had this thing on my toe, like it was bleeding or it had like pus. That stopped. And that actually has not returned yet. And I also experienced a lot of like recurrent vaginal infections. I also had like SIBO and stuff like that, which the SIBO never really completely resolved, at least according to my doctor. But I did have the recurrent vaginal infections, and that was like every single month. I mean, I rarely went a single month without getting an infection. And I think a few months ago, I thought I had an infection. I went to the doctor's. She did a swab, and it turned out negative. I didn't have anything. So as of today, I have not had a positive culture for any kind of vaginal infection. Now, if you've been watching my videos, a couple months ago, I had a bad sinus infection, and that was self-inflicted. So I'm going to put that out there that was self-inflicted. I was using a nasal spray, to prevent COVID, according to my doctor, and that did not go well. There's a car parking right beside me, but anyways, let me continue. So the nasal spray situation, I did it twice. The first time I did get like kind of migraine headaches, but it went away after a while. The second time resulted in pretty bad headaches and a sinus infection. I called the doctor. I was like, hey, I'm having these headaches. I was using this nasal spray, and she was like, you have a sinus infection. You need to do a Z-Pak, which is azithromycin for 5 days, which I'm very, very familiar with that drug. So I did that. Sinus infection cleared up, and then I ended up having a flare a few weeks later of my light sensitivity. That makes sense because I do think my light sensitivity is coming from up here, from some kind of structural issue up here in my sinus area. So it makes sense that that would flare up on top of all of the residual inflammation from the infection. Obviously, I'm going to flare up, and that's going to be the first thing to get hit because it's up here in the same area. And as you guys know, because I think I did a video on that, it may or may not be up. The videos will be coming just like once a week for the next several months. But I did talk about that flare and how bad it was, and it lasted several months. I barely was getting back down to my baseline light sensitivity, probably like in the last month or so. And I get hit with another sinus infection. So a couple weeks ago, I went back to the doctor's. I had a bad migraine. So today is Friday. I started the antibiotics. No, I finished the antibiotics last Saturday, so almost a week ago. And the Saturday before that was when I had a really, really bad migraine. Head pressure, nausea, it was really bad. And I don't typically suffer from migraines unless I expose myself to fluorescent lights or lighting that doesn't agree with me. Then I will have head pain and pressure. But as far as just having a spontaneous migraine, I did not know why. It seemed to come out of the blue. I have not used the nasal spray again since that last incident of the sinus infection. I did not use the nasal spray. I have not used it. I'm not going near it because it's a horrible experience, let me tell you. And so I don't know what provoked this sinus infection, but the migraine was on Saturday. The migraine was on Saturday. Sunday and Monday, I think I was still feeling weird. And I think by Tuesday was when I went to urgent care, and I was like, I think I have another sinus infection, because I started feeling the pressure right behind my nose. And it didn't feel as bad as the first sinus infection, but the migraine was really bad. It was only that one day, but it was really, really bad. So I went back, had to do another Z-Pack, so it was another 5 days of azithromycin. And as you know, I already have a bunch of digestive issues. So that's, it's only going to make a bad situation worse. So, I just finished the azithromycin. I finished it about a week ago on Saturday, and today's Friday. So it's almost a week since I finished it. And I'm now having some stomach issues, stomach upset, stomach irritation, as well as possibly a vaginal infection. So that long story was for what? So if I am now having unprovoked infections, right? This was an infection that I had already had a few months ago. I felt that it was provoked by the nasal spray. Now, I don't know what it's from this time around. I do use oxygen, so I replaced my oxygen cannula. I thought maybe there was something, it was dirty, or maybe the oxygen concentrator, because my concentrator has also been giving me issues lately. But I did change the cannula. But it's still telling me that my body is kind of vulnerable again. Because even when I was having the vaginal infections, I wasn't doing anything in particular, because they associate, BV with, sexual intercourse, things like that. None of that was happening. Yeast infections are typically associated with like antibiotics, not wearing breathable underwear. There's a lot of different theories behind it. I think in my case, it's just a bad immune system. And during the course, after the exosomes, I was not experiencing those things. I was experiencing a lot of other stuff, like an overactive immune system and worsening of my neurological symptoms. But I wasn't having the infection situation. And now it seems like it might be kicking back up. So, I'm kind of, and I have been feeling like just kind of off a little bit, as you guys know already from some of my other videos. My dog died, so that was also a huge hit to my immune system. I had cold sores. I had a huge cold sore and more smaller cold sores down here. So again, that's another hit on my immune system. It's telling me that my immune system is kind of getting faulty again. And so, I'm starting to see that. Obviously, this seems kind of like the beginning, because it's only been twice. The first sinus infection was in February. It's mid-May, so it's been a few months. Sometimes that happens. Like, I'll have the infections a few months apart, and then they just start coming back to back to back. And so, I'm kind of, I also had, because I went to urgent care today. She told me about the stomach thing, and then she did a swab to see if I had a vaginal infection. So I'll be getting those results soon. So if I do have a positive result, then I think it's pretty safe to say that my immune system is just not fending these things off very well. Granted, I did do antibiotics, but I don't know. I actually didn't get, with the last round of antibiotics, I didn't get any kind of vaginal infection, and I was pretty surprised. So, I'm starting to kind of feel like maybe whatever small positive effect the exosomes did have is gone, or is leaving. Whatever messaging or whatever was happening may be going away. And so, I haven't tried my IVIG again. It might be a good time to try it soon. But I haven't done that. I am afraid that it might throw me into flare. And as I was saying, I already had the flare of the light sensitivity, the head pressure, the migraine from the from the sinus infection. So I didn't want to make that worse, because if the IVIG is still not agreeing with me, it causes a worsening of some of my neurological symptoms like head pain, neck pain, and stuff like that. So I do have to be a little bit careful with, when I decide to do it, and maybe just do like a really low dose. But I feel like the time is getting near for me to try it maybe one last time and see whether it works. Because I think the only reason that it was kind of helping me before was because there was some kind of weakness with my immune system. And then after the exosomes, it was almost like my immune system was supercharged, and I don't know why. I don't know why it was, why it was doing that, but that's kind of what it felt like. Like my immune system was supercharged and super strong, and it was attacking me, even worse, even if it was fighting off infection, and keeping the infections at bay. I also have like a little patch of, I'm thinking like dry skin right here, possibly an eczema flare, which IVIG always kept my eczema at bay. That's another thing too, by the way. So right now that I'm talking about my skin, the other improvement that I had reported to you guys was that my skin cleared up. And my skin, the skin on my face had improved quite a bit. My pores got smaller, acne cleared up, that kind of thing. And, I had a lot of back knee that seemed to clear up. I had back knee on my lower back as well, on my abdomen, and a lot of that improved quite a bit. I want to say a couple months ago, I kind of went on a little bit of a sugar binge, and I noticed that my acne on my back and my chest started flaring up again. And so I stopped, but my skin did not bounce back as well as I had expected. Obviously, again, that was provoked, self-inflicted. But I am noticing that the skin on my back, it has this, before I did the exosomes, I had this like grainy, on top of the acne, I had this like grainy kind of residue feel coming off of my skin. I would actually scratch my skin, and there was like, it seemed almost like dirt. But I wasn't dirty. It's like my skin is trying to get rid of something. Like obviously your skin is one of the largest organs that you have, and you detoxify through there as well. And so I think something was trying to come out. And judging by the fact that whenever I have sugar, I break out, it's got to be something related either to candida or just, I don't want to say toxic buildup, because that sounds just like I'm guessing. It's like something, like my body is trying to get rid of something. And that's back. And it's actually been pretty persistent since that sugar binge. The acne feels like it's clearing up a little bit, but I still feel that graininess. And I have it on my upper back and my chest. My lower back still seems to be clear, which I'm happy about. But obviously, if all of these other things are coming back, then my guess is that eventually, it's going to start coming back there as well. The skin on my face is still doing okay. I did get one large cystic acne. And that's another thing too, was that I noticed that whenever I would get acne, especially on my face, it would go away very quickly, like very fast. And with me, whenever I would get acne, it would take forever for a pimple to go away. I mean, it would take a really long time. After the exosomes, if I did happen to get a pimple or like, something, an inflamed kind of pimple, it would be pink. And then like by the next day, it was gone. Like the redness and everything had gone down. Now, I had this one cystic pimple, and this one has been probably close to 2 weeks, probably over 2 weeks. And, it's still there. It's going away, but it was a cystic pimple, and I hadn't had a cystic acne like that in quite some time. The skin on my face is still doing more or less okay. I am noticing more blackheads though, but it is, my face is still doing okay. I think I have something up here too. So I am noticing that little by little things are kind of reverting back to how they were. And I'm just kind of thinking to myself, okay, like, is it time for me to try my IVIG again? Or, is this a sign that we have to move on to something different? Because if I'm off of my IVIG too long, because my IVIG was helping me, it wasn't doing everything, it wasn't curing me of anything, but it was helping me. It was just after the exosomes, the IVIG, for whatever reason, just was not, my body was just not tolerating it. And I think that's because my immune system was supercharged, which is also the reason why it was probably fending off or holding back infection. And now it doesn't seem to be doing as good a job at keeping infections at bay anymore. And again, we're kind of in the early stages. I've had the 2 sinus infections, haven't had a positive vaginal culture yet. So, I'm waiting on those results. I don't know if it'll come back positive. Even if it doesn't come back positive, I do feel like, my body is the exosomes, whatever positive effect the exosomes did have, is just not there anymore. And it's probably, going to be fading away completely within the next few months. So, I felt that this was important because it can give you a timeline as far as, if you do have negative effects, because I know that there are other people in the exosome support group that have had the same experience that I've had, and that they're reporting that they just did not feel well. They felt worse after exosomes. And a lot of them were asking, how long is this going to last? How long am I going to be like this? Is this going to keep getting worse? And I did have a doctor tell me, she said, no, eventually you'll go back to however you were before. And I'm kind of like, am I? Am I going to go back? Because it's been over a year. As far as my thoracic neurological symptoms, they don't feel as bad. I feel like maybe I'm close to baseline, but also too, when I have stomach issues, which I'm having right now, it kind of makes it difficult for me to tell whether I am going back down to baseline, or if a lot of the stomach and intestinal issues are causing that feeling of tightness. So, it's really, the only way for me to know is to do the IVIG. And if the IVIG is still causing, that flare up or that weird reaction, then my immune system is probably still in a heightened state, or I'm just no longer going to tolerate IVIG. So, it might be worth me giving it a shot, and seeing whether I'm still going to react to it the way that I was before, because I will need some kind of intervention, especially if I'm going to start having these recurrent infections. Having to take antibiotics, particularly azithromycin, which I've done a lot of, it's not good. It's not good, and it's eventually going to mess up my stomach even worse. Even though I do have SIBO and an overgrowth of that, eventually it's going to start killing that off and might end up with an overgrowth of something else, maybe candida, maybe some other issue. There are other issues like C. diff that can come with that. And seeing as how I am having issues fighting off infection, that is definitely a possibility. So I'm looking at, it's 14 and a half months, maybe close to 15 months, and maybe the effects of this exosomes situation are finally going away completely, and I may be reverting back to how I was previously. So keep that in mind if you are going to do this treatment, that the effects could last, negative effects could last well over a year, and positive effects could stop somewhere around, a year as well. So, those are things to consider when you're going into this treatment. So, I'm trying to think if there's anything else. I think that's about it as far as the exosome situation goes. I will keep you guys posted. Like I said, I'm posting probably about a video a week at this point, because we have a lot of people at the house right now, and there's been a lot of other things going on. So I'll try to keep getting you guys some kind of content, so that you have something, some updates, some knowledge of what is going on with me. I really wish I would have had a much better experience with the exosomes, because I really thought that I was going to. And I really feel like this is definitely worst case scenario. When it comes to treatments like these, I don't think everybody's going to have the same reaction, but at the same time, you know, there were a lot of factors, and I do talk about that in another video where I talk about what I think went wrong. So look out for that video. If it's not up yet, it should be up sometime soon. So anyways, thank you guys so much for joining me, and I will see you in the next one. Take care.